Al Capone, Adolf Hitler, and Abraham Lincoln. What do all of these people have in common? They all had syphilis.
You might be wondering, what is syphilis? Well, syphilis is a disease caused by the bacterium Treponema pallidum, which is a gram-negative organism. Cells are helical-shaped and have very low metabolic capabilities, as they only code for a few proteins.
Syphilis is a sexually transmitted disease and can be spread by sexual contact or by touching syphilis sores. Ew! Because this disease is transmitted sexually, the primary reservoir for it is people.
The prevalence of syphilis varies from country to country. It is most common in Latin America and Africa. In the United States, the rate of syphilis is 6.3 individuals per 10,000.
The pathogen affects the vaginal, anal, penile, or oral tissues of the body since it's sexually transmitted.
Syphilis's incubation period is between 10 and 90 days. Syphilis is sometimes called the Great Imposter because its symptoms resemble those of other diseases. Some symptoms of syphilis include cankers around the infected areas, fevers, fatigue, swollen lymph nodes, and headaches. There are 4 stages of syphilis: primary, secondary, latent, and tertiary. Early symptoms include cankers. About 70% of patients with primary syphilis develop swollen lymph nodes near the canker.
Secondary syphilis occurs between 6 weeks to 6 months after the infection. During this period, mucous membranes erupt and skin rashes appear. About 50% of patients with secondary syphilis get swollen lymph nodes in the armpits, groin, and neck. 10% of patients get inflammations in the eyes, kidneys, liver, spleen, bones, or joints.
In early latency, secondary symptoms may appear, which are less common in late latency. Tertiary syphilis can either be benign or cardiovascular and/or neurosyphilis. Syphilis can be treated by antibiotics, which kill the bacterium responsible and prevent further escalation. However, there is no treatment that could reverse the effects caused by later stages of syphilis.
The disease can be prevented by practicing safe sexual practices, such as using a condom, a dental dam, or limiting your sexual partners. STDs are inherently difficult to track and treat because of concerns about privacy and the social stigma surrounding them. As a result, the exact number of syphilis sufferers is not known. As well, most cases occur in developing nations, which compounds the difficulty. In order to lower syphilis rates, the Centers for Disease Control and Prevention recommend reporting all syphilis cases to the local public health office and supporting contraceptive use and education in developing nations.
Don't be like Al Capone. Pay your taxes. Wear a condom.